Hi, everyone. I'm Maimah Karmo, founder and president of Tigerlily Foundation. And I have a special guest you're going to meet very shortly, my friend and dear friend, Congresswoman Debbie Wasserman Schultz. We'll be talking about an important topic around survivorship care plans and why it matters to you. Hope you enjoy the conversation. Hope you're inspired and take action with us today on the Hill. Thank you. It's great to
Sure.
see you. And I'm just so, for those who are watching this, just so thankful to have you as a partner and a friend. We began this journey almost 15 years ago, both coming out of our breast cancer journeys. We both had a story to tell, had big things to accomplish, didn't yet know what we were going to do. What we created in that space was a beautiful friendship that is beyond just the word. It became something that has changed so many lives around the early act and then PALs of advocacy and policy and how when you come together in a real space, how beautiful things can happen to really impact survivors throughout their breast cancer journey.
It's so true, Maimah. The notion of sisterhood that really has become so associated with survivorship, but the sisterhood of survivors is so strong because only we know what it was like to go through that hell. There's just not a word. Devastating is even not a word that lives up to that.
And so that's why I push. That's why you push, because for me, the more we can push and strive towards excellence in healthcare access, equity, acknowledging patients, and the importance of advocacy, people will continue to die.
Right.
And I think about the things that you've been able to do, such tremendous things in the policy space, and myself as an advocate to empower women of all colors, especially Black and brown women. What if we weren't here today, Because someone thought it was okay to tell us to come back in our 40s. And those who are metastatic have far more, I shouldn't say, well, they have far more intense problems, it's just true, right?
Yeah.
Because their plans would entail they're looking at new clinical trials, and the trials are trial drugs, so they have side effects. They're
Mhm.
looking at maybe dating or lifestyle, and wanting to have a relationship and not having the support. But there's no care plan for patients who are MBC patients.
Right.
So I think it's really important to consider, early stage meds patients. So it has to encompass all ages and stages of young women going through this process. Equitable access for those who are underserved in communities that have really a lot of barriers. How do we ensure they have equitable access to these plans?
That is so critical. Your geography, your socioeconomic status, your ethnic and racial status should not impact your access to the healthcare that you need and the treatment that you need or the guidance that you need. We need the involvement from the highest level of government, the Department of Health and Human Services, their sub-agencies, and getting the expertise to be applied to properly address equity is so essential because we need research done to make sure we're developing the kind of training programs and continuing education programs that are going to help make sure that that access is distributed more equally. And in our survivorship legislation, we need to legislate it.
No matter how strong you are, and I'm seen as a fearless warrior, I'm fearless, but I get scared, I get worried. I had fertility issues, heart issues, lung issues, fear of recurrence. And there's so many things that we deal with, mental health, that aren't covered by survivorship care plans. Did you have a care plan in your community that you benefited from? And if not, what would you have wanted to have during that time?
Yes, I had a survivorship care plan in the sense that I was told very clearly what I needed to do to regularly make sure that I was monitoring my breast health. Survivorship care plans include a record of a survivor's cancer and treatment history, checkups, follow-ups, knowledge of the possible long-term effects of what their original treatment was, which could be, putting them at more risk for other cancers in the future. So the intent of a survivorship plan is to help guide you through cancer in collaboration with your doctors. And there is so much new and scary information that gets thrown around that a care plan is absolutely vital. But it's not always easy to access. It's actually very difficult. And then there's the whole issue of getting it covered. It's taken all this time to get the kind of recommendations that we needed for what really strong survivorship legislation would look like.
In your district, there's a leading model for survivorship care plans that Moffitt Center is doing, right? And that's really awesome. We can just brag on them right now because it's a great care plan. They have a great team. Can you tell me more about what you know about Moffitt and what they're doing in your district?
Absolutely. Just so proud to have worked with Moffitt, and that they are based in my home state of Florida, because they have understood that these care plans need to really do things like provide for Medicare coverage, which of course so much of it doesn't now, that you need a cancer care planning payment system, coordination for services of all survivors. You need the development of treatment plans in follow-up care, revisions to that so it's tailored to you specifically, transition from oncology to primary care, so you can ensure that you have integrated, level playing field, well-managed care for all survivors. And that's the starting point for my legislation, which Moffitt has really been remarkable in helping us build. They're a wonderful partner, and they've been key in so many of our cancer-related initiatives, whether it's legislation or appropriations. So I'm so thankful for them. The model that Moffitt presents is really what you want to try to get everyone to be at.
I love that. And so, you know, you and I love policy, but I love policy work. It's been the beauty of my work. But what role can policy play, to your point, in getting it standardized for all to have access to survivorship care plans? Because it should not be like a, you know, this person gets it at an NCI center or center of excellence, and those don't get it, who are not who are in community-based or underserved communities. What is your plan for policy, and can you share with those who are watching in the audience right now?
For sure. So we need increased access and standardization, along with studies that look to the disparities and discrepancies, so we can combine those to provide better resources and care for survivors. We need to realize that survivors need better access to the services that they require, and that we've got to take into account that every survivor has different needs, a different story, and then
Different times.
right. And at different times in their life. So communicating with your own doctor about the gaps that you're experiencing is so important. Organizations like Tigerlily that use the strength of your network to be able to advocate at that level.
But I just love our conversations. I love our sisterhood. I want everybody who's watching this to know the importance of survivorship. We need a plan for all that's equitable, accessible, fundable, and that can help people survive and thrive, you know, during and after breast cancer.
We need to stand up for ourselves.
Yes.
Every person, every patient needs to be, it starts with being your own advocate.
Best advocate. I agree.
Courage.
So good to have you. Be fearless. Be fearless.
Seeing everyone in person.
Yeah. See y'all soon. Thank you so much,
Bye.
Debbie.